compliance, I need to make some forms. So one of them was orthotic measurement form, back braces, knee braces, you name it, we like draw it, just write it. I usually just make up the numbers, not a big deal. Same, and then so when they get any type of brace, you need to have, like, obviously size them and then fill out this follow-up plan of care. I honestly don't know, like, if all these are necessary for all patients or whatever, but that's what I've been doing. I usually just fill out patient's information, all items reviewed and unchanged. So if it's unchanged, don't fill out anything. That means I never fill it out. Patient status, most of the time improved. Sometimes I write like they never had swelling to begin with, so I just write like NA or something. Sort of information is patient. I'll also fill out like an example of this later. But equipment settings, back brace, lumbar, orthosis, whatever. Frequency of use, like QD to BID, duration, like 4 to 6 hours, PRN. Like I just write whatever. And then just like a little scribble here of need. Okay, they have doctor wrote diagnosis of lower back pain. Goal, improve status. Results, patient's pain lowered, swelling decreased, patient enjoys back brace or something like that. And then like all this other stuff is always the same, so I'll just do that in an example form. When people get...
Do we need to actually submit that online or something?
No. It's just if they come in to check on our claims, like we'll have that. If people get a mastectomy form, a mastectomy brawl or something, I usually do this. So this comes with a measurement form right here. So you have condition of skin, surgery side, measurements, data pickup. I might need to alter this a little because, actually I don't have to, but we need to write a subjective and objective assessment. So we can't just like, patient likes it. We have to write like, fits well, if patient leans over, boobs not spill out, or prosthesis stays in place, like something like that. It makes more sense for diabetic shoes because I don't know exactly what to write here, but order form.
Objective and subjective, so the patient also has to say something.
I mean, like, okay, what I used to write for the last thing is these diabetic shoe forms. So what I used to write was just like, oh, patient likes shoe, patient feels comfortable, something like that. Is that objective or subjective? I forgot which one it was, but we need to have one that's like not based on our opinion. So it's like, if like patient, another assessment would be like, okay, patient walked around, no slipping of heel, like something that it's not like based on an opinion.
Okay.
So it's just like assessment of, okay, patient wore it around the house and experienced no discomfort, or no redness around her bunions or something like that shows that the foot was too small or something like that. So just something like, I think
that's not based on our opinion.
Yeah, that's like we actually assess. Yeah, so that's why I wrote this. So like a patient's subjective comments like, oh, they like it, it's comfortable, too big or something. Technician objective examination, patient walked around and there is no slipping of heel, and there is adequate room for their hammered toes or bunion or something like that, or like the lycra fabric helps conform to patient's bunions to prevent something, and then the follow-up. So every time patients get something, I've been filling out this 48-hour follow-up, just writing initial date and time, and that correlates to this follow-up date, so obviously it should match. For some of the follow-ups, I also do the patient satisfaction survey. I don't know if you remember that. That's in that binder. Do you want to pull it out? Because that's something we actually need to submit online. So I don't know how often we need to do it, but I've just been doing it maybe like once a week per review. Basically, when they picked it up, what type of equipment name. most of the time it's just like yes. I rather in the phone number because when you submit it online, you have to show them if it was an in-person survey or on phone, and obviously they're not going to come back within 2 days to be like, yeah, I like the service. So they're all like phone call, I write my name, and then when I did the survey. So they should always be within like 1 to 2 days because that's when it said the 48-hour follow-up. This is every week basically. When I submit claims, I choose one to like call the patient to ask the survey.
So you only do one case a week.
Yeah, but honestly, I don't know if that's like too much, if that's too little, but it shows that we're actually doing it, so I think that's all they need. And then every time it gets like...
And we just pick any of the equipment.
Yeah. I mean, obviously, the ones that you can definitely for sure know that there's enough information and stuff, like wheelchairs and stuff, like I don't try to do that because there's rental and it's just like complicated. But once it gets like too much, like right now I have 2, but once maybe like every month or something, like after I have like 5, then I'll then I'll just go onto the website, which is the, do you see compliance? Oh, right here, compliance team. Password is already in the Google Docs password thing, but yeah, you log in. This is where I find all the information about accreditations, like manual and stuff. So that's in the documentation, but we're doing just a survey. So we're gonna create a universal survey. I honestly don't know if like this is like super necessary, but okay, it was a phone survey method was phone, information, patient's name, patient's phone number, equipment. So they got a cane. It was new. I usually just leave the model and serial number blank. Date of service. Your name first and last. When the survey was conducted. Your name again, or like technician name. I leave store number blank. All these are, you know, yes or no comments if patient said anything, and then you just submit it. So I know they told us that like we didn't do these when they first came in, and like I didn't even know about it, and so they definitely thought that was bad. So I mean, even if we don't do it every week, I feel like just a couple, like a month or something like that, like just showing that we do remember, then I think that's fine.